north zone of the CNRS. Our honorary patron, Dr. Suvarsh Khanna, who may not be here with us right now because of the time lag, as in the US, it's the morning hours in the and Mrs. Uma Handa, who is the advisor of the CNRS. It's just because of these two great personalities that the CNRS came into being in August 2019. So it was, yeah, maybe the date is little changed. Maybe the 18th, it was just under the planning process when in the 18th April 2019, and officially it was launched at our college, the Rajasthan, in August 2019. Next slide, please. As far as if we come to the aims, vision, mission, and the objectives, the first, let me come to the aim, why this was CNRS was constituted. The main aim was to encourage and improve the quality of the clinical research in nursing, to generate evidence and its application in nursing practice and education at par with the global nursing standards. The vision is to create a global platform of nurse researcher for excellence in nursing research and capacity building for its execution and sustenance. Our mission was to promote evidence-based nursing research in clinical practice, to develop the policies and standardized clinical guidelines to provide the evidence-based quality care, then to achieve national and international interdisciplinary collaboration, dissemination, and utilization of outcomes of clinical research studies to improve the quality of nursing care. And lastly, to enhance the visibility and active involvement of nurses in policymaking decisions as national as well as international levels. The main objectives for which it was constituted: to provide opportunities to the nurses with technical support to comprehend research methodology and its clinical applications for facilitating healthcare outcomes, to promote clinical specialization for empowerment of nurses to improve quality of patient-centric care, to explore funding the resources for individual and the group research in clinical practice. Next, to follow the ethical guidelines as per regulatory bodies, to collaborate with other national and international professional nursing bodies to promote evidence-based nursing, and to have regional chapters of the society. And we are proud for this moment, there's the first regional chapter of the West Zone is launching today. Just in brief, this is the executive members, the picture of the executive members of the CNRS. In the center, this is the honorary patron, Dr. Suvarsh Khanna, and Dr. Pratap Midda, the director of our hospital, Global Hospital and Research Center, of which our college is a unit. And these are the various committees and the name of the persons, executive members, all the committees with their names, various committees, research committee, peer review committee, and all, bylaws committee, and membership and election committees. We plan to have 4 zones, all in the north, west, south, and east. So today is a very important day in the history of the CNRS, and it is again another milestone to launch the north zone of the CNRS. So welcome the North Zone members. So there are usually, I'm sure there are members from all the 4 states of the North Zone. So first of all, I welcome the President of the North Zone, Dr. Lata Venkateshan, who is Principal of the College of Nursing, AIMS. I welcome you, ma'am.
Thank you, madam.
Then the Vice President of the North Zone is Dr. Kamlesh Kumari Sharma, the Principal, Institute of Nursing Education and Research, AIMS, Bathinda. Welcome, ma'am.
Thank you, ma'am. Thank you.
Secretary, North Zone, CNRS, Ms. Cecilia MS, Associate Professor, College of Nursing, AIMS, New Delhi. Welcome, ma'am. Then Professor Dr. Smriti Arora, Principal, College of Nursing, AIMS, Rishikesh, Joint Secretary, North Zone. Welcome. Dr. Sushil Kumar Maheshwari, Associate Professor, Baba Farid University of Health Sciences, Faridkot, Treasurer of the North Zone. Very important position, North Zone, CNRS. Welcome, sir.
Thank you, ma'am. Thank you.
So these are the chairpersons of the various committees. The Education Committee, Dr. Lekha Vishwanath, Principal, Nursing College, Deputy Director, and Nursing Service, Amrita Hospital, Faridabad. Welcome, ma'am.
Thank you, ma'am.
Yeah. Then Election and Membership Committee, Dr. D. Marilyn Flincy, Principal, Apollo School of Nursing, Indraprastha, Apollo Hospital, New Delhi. Welcome you, ma'am. Then I come to the Research Committee, Dr. Muthu Venkateshlam, as Assistant Professor, Institute of Human Behavior and Allied Sciences, New Delhi. Welcome, sir. Chairperson of the North Zone. And then comes to the Ethics Committee, Professor Dr. Shrivasan Kari, S. College of Nursing, Institute of Medical Sciences, Banaras, Hindu University, Varanasi, UP. Welcome, ma'am. So these are the various committee, and I'm sure the members also must have been there, and I hope we will be having many more members from the North Zone, and I'm pretty sure and very optimistic that the CNRS North Zone will keep on contributing very effectively in future to achieve the ultimate goal for which it is established. Wish you a great success, and I wish everyone a successful and a fruitful webinar today. My best wishes, and thank you.
Thank you so much, ma'am, for your encouraging and motivating words. President, Clinical Nursing Research Society. The overall purpose for this society is to encourage and improve the quality of clinical research in nursing, to generate evidences and its application in clinical practice and education at par with global standards. Thank you so much, ma'am. Now moving ahead, this world is full of diamonds and gems, and we are having some of them here today. To build this event a great success. With this note, I would like to give my heartiest welcome to our beloved teacher, Dr. Lata Venkateshan Madam, Principal, College of Nursing, New Delhi, and President of North Zone CNRS, to have more highlights on CNRS North Zone chapters, its vision, its objective, and future plans. Dr. Lata Venkateshan Madam is currently working as professor cum principal in College of Nursing, AIMS, New Delhi. She has 32 years of rich experience in education, clinical nursing, and administration. Madam started and established colleges and schools in India as well as in Bhutan. She organized several international and national conferences, workshops, TOTs, faculties, and student development programs. Madam published several articles in index journals, authored various textbooks, and she had an important role as an editor of national and international journals. Madam had been is member of various boards and various universities in various universities and including AIMS and other institute of national importance. Madam is founder member of Association of Nurse Executive of India, and she is also founder president of North Zone CNRS North Zone chapter. Welcome, madam. Over to you, madam.
Thank you, Dr. Sushil, for that kind introduction. Respected chief guest of the day, Dr. Deepika Kaka, Nursing Advisor to Government of India, President of CNRS Headquarters, Dr. Sashi Bala, Office Bearers of CNRS Headquarters, Office Bearers of the North Zone of CNRS, members of CNRS, and enthusiastic delegates of the event who have joined today. We are thankful to God Almighty for uniting us together in CNRS. It is a significant day in the history of CNRS that we are branching out into zones. North Zone is the first zone to proliferate. Zonal branches will expand opportunities and provide forums to showcase regional talents. The advantages of getting associated with any professional organization is that it will provide opportunity to update yourself with latest knowledge in the industry, networking with national and international associations and experts, cross-learning through sharing of best practices. And CNRS North Zone will also enhance the benefit programs like group healthcare benefits, rewards and recognition programs, privileged access to events and conferences, facilitating innovations and new developments and opportunities to give back to the community. Of course, CNRS North Zone will work within the ambit of its headquarters and committed to the goals of the main CNRS. CNRS North Zone is launched on this significant day where the entire world is observing Suicide Prevention Day. It is a day that spreads positive hopes that suicides are preventable if planned in advance. As it is a research society, the evidence-based practices are linked to execute our strategies for the purpose of mitigating suicide with scientific evidences. The keynote address, which is going to be delivered by Dr. Deepika Kaka, she being herself a psychiatry specialized nurse and nursing advisor to Government of India, will enlighten all of us the opportunities wherein nurses can significantly bring changes in the field of suicide prevention. The eminent faculty expert panelists are here to discuss about the unique evidence-based strategies for suicide prevention. And I must make a special mention here about Dr. Sushil Kumar Maheshwari, the Associate Professor of Baba Farid University and Treasurer of CNRS, for suggesting and having initiated the program, which eventually resulted in launch of North Zone of CNRS over a very quick notice. I thank all the office bearers of CNRS headquarters and the North Zone for making the event successful on a very short notice. We also welcome all the delegates of today's program to become part of CNRS. Please become members of CNRS and strengthen the association and make use of the platform to take our profession to next level. Thank you very much.
Thank you, ma'am, for sharing your thoughts with the audience and all the EC members of the North Zone CNRS. Being a treasurer and EC members of North Zone CNRS, I would like to assure you that on behalf of all other EC members, we will move on the path shown by you for the upliftment of nursing research, sharing knowledge, and encouraging evidence-based practice in our country. Thank you, ma'am. Now, it's time to come on the second part of this day, that is the celebration of World Suicide Prevention Day, with the theme of creating hope through action. It is estimated that nearly 7 lakhs people in a year take their life around the world. For every suicide, there are likely 20 other live people making a suicide attempt, and many more have serious thoughts of suicide. Millions of people suffer intense grief or are otherwise profoundly impacted by suicidal behavior. Each suicidal death is a public health concern with a profound impact on those around them. By raising awareness, reducing the stigma around suicide, and encouraging well informed action, we all can reduce instances of suicide around the world. World Suicide Prevention Day was established in 2003 by International Association for Suicide Prevention in conjunction with WHO. The 10th September of every year focuses on attention on the issues, reduce stigma and raise awareness among organizations, governments, and the public, giving a singular message that suicide can be prevented. Creating hope through action is the triennial theme of the World Suicide Prevention Day from 2021 to 2023. This theme is a reminder that there is an alternative to suicide and aims to inspire confidence and light in all of us. It's a great honor for me to introduce and welcome the chief guest of this webinar. This person merely requires any introduction. She is well known for her work in the field of psychiatric nursing and counseling of patients and students. She is none other than our loving teacher, Dr. Deepika C. Khaka. Dr. Deepika C. Khaka is presently working as nursing advisor, DGHS, Ministry of Health and Family Welfare, Government of India. Madam has been Amazonian of America Award for the year 1999, Amazonian of America Award for Best Research in 2006. She has received Top Poster Award in Evidence Live 13 conference at Oxford University, UK. She has received Nursing Excellence Award in 2021 and awarded Fogarty Fellowship in New York University 2002 to 3. She has published several articles in index journals with citations nearly 500. She authored 10 chapters and monographs, attended more than 62 conferences, and organized several workshops. Madam has been speakers in more than 150 international and national conferences, workshops, TOTs, and other faculty and student development programs. She has received 7 award papers. Madam is national and international consultant, editor, and reviewer in more than several national and international journals. She is PhD and MSc research supervisor. Madam is actively working in the field of counseling in ICTC, and she is involved in WHO advisory working group. Over to you, ma'am, to share your in-depth knowledge on suicide prevention and for keynote address. Welcome, Dr. Deepika Khaka.
Thank you so much, Dr. Sushil Maheshwari, for your kind words. It is always a source of great gratification for a teacher to see her student blossom and do so well. And I can see so many of my students here. It's very gratifying and a very fulfilling feeling. I would like to thank the organizers, Dr. Lata Venkateshan, Dr. Kamlesh, Dr. Shashi Bala, Dr. Muthu, Dr. Sushil, for giving me this opportunity to speak on a very important area. And on this special day of Suicide World Prevention Day, why we have activities like this is so that we can generate awareness. We can, help people to reach out. We can encourage people to seek support, because suicide is preventable. And we don't need, not only a healthcare professional or a mental health expert can do the initial psychological first aid. Anybody can, give a gesture of help, like by listening to a person in distress, in crisis, or give a shoulder to cry on. These can be also lifesavers. Sorry. As Dr. Sushil Maheshwari mentioned, the suicide rate is on the rise. There can be many reasons to that, like as he mentioned, that 7 lakh people die of suicide every year, and which is a very alarming sign for us as healthcare professionals. Generally, the suicide which occurs are in young people from the age of 15 to 44, which is one of the most productive years of a person's life. And suicide is now, according to CDC, the 4th leading cause of death It is a grave public health problem now. And it is not only the high income countries which are more prone, even the middle and the low income countries also have seen a kind of acceleration in the rate of suicide. The population at risk for suicide is not only patients with mental illness. Now it is now shifting to people with social problems like chronic illnesses or facing discrimination, facing some emotional turmoil, and issues like that also are coming up as important. Even having family problems, having love failures, these are also now increasing. Their rate is increasing and can be a reason of suicide. Now, as I said earlier, suicide is preventable, and it can be a lifesaver if you give somebody time of your day and listen to the problem of an individual. So prevention can be done by us, by raising awareness among the general population, the general public, to destigmatize mental illness. This is very important, because generally when a person reaches out for help, this should not be viewed as a sign of weakness, but should be appreciated as a sign of strength. How we can prevent suicide is that by, as I said, by raising the general awareness among people, limit access to any means of self-harm, like ammunitions, reduction of ammunitions, or any kind of pesticides. People should not have access to those kind of things. We should interact with media and not glorify suicide. The way media reports suicide have to be also taken into account, and there should be responsible reporting of suicides by the media. Then we have to also work on building social skills among the adolescents and the younger population, so that there are healthy coping mechanisms are being exhibited at the time of crisis and in need. We have to identify and manage anyone who is having any kind of vulnerable behavior which can cause self-harm. And these go in totality. Like, we have to focus on the multi-sectoral collaboration right from the beginning. We have to sensitize the teachers in school to pick up any red flags if a child is having some kind of deviant behavior, to kind of give some extra support to the child, not stigmatize the child if he's showing any abnormal behavior. Then we have to raise awareness, as I said earlier. We have to do capacity building of our healthcare professionals, like we are having this webinar here, so that people are able to learn and make a difference. Then we have to monitor and evaluate how we are going about in that. So suicide prevention requires coordination and collaboration of multiple sectors of the society, like healthcare sector, education, industry, law, defense, media. So everybody needs to be sensitized, and there should be a liaising and cooperation between these departments. What we can do as prevention is that we have to develop and help people and tell people to have their own support system, their inner circle of friends and family whom they can bank on in the time of trouble. Have good mental health well-being, take care of your physical health as well as mental health, have healthy coping mechanisms to deal with everyday pressures of life. Then do self-care, engage in physical activity, keep yourself physically as well as mentally fit. And so the approaches by which we can handle and prevent suicide is that we engage people. Like, there are some survivors, those stories are very powerful in people who are struggling. So we can tell the survivors or the people who have battled through depression, how they went about in handling that situation. So we can engage people with lived experiences to talk about it. Then we can empower everybody regarding self-care and how to effectively cope, and propagate about crisis management, that if you are in crisis, which doors to knock, whom to seek help from. Then we have to empower people regarding self-care, and also people should have access to the helpline numbers, crisis intervention services, whom they can knock at in the time of trouble, and ways to cope with stress, have healthy coping mechanisms, and have support system to handle in case they face a rough weather. So as healthcare providers, it is our moral responsibility to generate awareness, to tell people coming out and asking for help is healthy. It is not a sign of weakness. And you never know if a person, and I will also like to say, I'm sharing from my personal experience, if anybody comes to you for help, or anybody comes to you and tells your problem, That means this person is considering you or trusting you or keeping you in that high pedestal that you will help that person out. Never be too busy for any, for we all have very tight schedules. We are all professionals. Sometimes we can, get angry and say that I don't have time. But I have seen in my personal experience that when somebody, like one of the students came to me or one patient came to me, and I gave them time of my day. I talked to them, and later they told that, that was a big, big support for them. It changed their life. It helped them to come through crisis. Many students come and tell me, you don't know what you have done for me. You have really changed my life. So all of us need to be sensitive and have that empathy that if somebody is coming at your door and asking for help, that means that person expects something out of you. That person feels you are the right person to go and approach, and you will help. So never be too busy for anybody who's coming to you for help that you tell the person to come some other day. I'll just share a personal story, which is a lived experience which I had when I was doing HIV counseling. I have a very versatile background. I have done bedside nursing. After that, I did HIV counseling for 4 years in the Department of Medicine at AIIMS, New Delhi. Thereafter, I was engaged in teaching. People who know me know my background. So I used to, when I used to take classes, I used to share my HIV counseling story with my students. This is a real story which I encountered, that, I generally in HIV, both the husband and wife are positive. So this one person, his wife was also positive, and the wife all of a sudden became acutely sick. And the wife was brought to a casualty in one of the hospitals. And what happened, this patient's husband, the lady's husband, told the treating doctor that my wife is HIV positive. At that point of time, when this lady fell, acutely sick, this man had 4 daughters. They were all unmarried. And the first daughter's, marital alliance was going on. And this boys' party had come to their house for some negotiations. At that point of time, this lady all of a sudden fell acutely sick. So the boy's family also brought this lady to the casualty. So the lady had come to the casualty not only with her husband, but the boy's party also had accompanied them to the casualty. Now, since the husband told the doctor that, my wife is HIV positive, this doctor did not maintain confidentiality, and he made a big noise in the casualty, and he told everybody, this patient is HIV positive, please be careful. So the boys' party came to know this lady is positive, though her daughters were negative. They were not infected with the virus, they were affected by the virus. So the boys' party went back and they cancelled the alliance. Now this patient came to me, he was very disturbed, and he came to me in one of the OPDs and he told me that, madam, this is what happened. I was treated so badly, and my wife, then the wife also died. So I lost my wife and I lost the alliance. And in society, I have 4 unmarried daughters, and nobody will marry my daughters because now they have come to know things spread like fire, like things like this. Everybody will come to know that, I am HIV positive, and because of that, my daughters will suffer. Now, I don't remember what I told him. I must have given him support and I must have told him something. I still don't remember what I told him. A few days back, he came back to me again. And he told me, madam, I had come to you that day. I had planned to commit suicide that night. But you heard me out. You gave me such a lot of support. And because of that, I changed my mind. That day, I realized that our words have got power. Our words have got power to destroy our life. Our words have power to sustain or make a life. So especially when we are in the capacity of healthcare providers, we have to have that sensitivity that suicide does not only pertain to anybody, having a chronic illness or anybody going through tough times. Anybody coming to a healthcare facility, we have to understand, is not a very happy person. There are people with a lot of baggage. There are people with healthcare issues. They can have financial implications. They can have social problems because of the illness which they are suffering. So we as nurses should be very sensitive, have that empathy that you are dealing with a high risk vulnerable population. So we should have that kind of, positive mindset that when we are dealing with these people, that we have to remember that they are looking up to us for help. They are looking up to us for support, and we have to do our needful as and when required. We should never say we are too busy. We should never say we don't have time. We should never say, we all have our own set of frustrations, but we should never displace our anger or frustration on the patient or the family member. We have to have that kind of sensitivity. And I really congratulate the CNRS for holding such an educational activity, because we understand and hope that with this, there will be, change in attitude. People will try to understand the self-harm behavior in much depth, and what is the prevention strategies which we can use to help people from causing self-harm. As I said, any support, listening to their story, helping them can be a lifesaver. So the prevention strategies are like, you can have safe reporting and messaging regarding suicide. Media plays a very important role. Next. Next slide, please. So Suicide Prevention Day has been established in the year 2003 by International Association of Suicide Prevention in collaboration with WHO. And why we are having this Suicide Prevention Day is, it focuses on the issues like reducing stigma. Destigmatizing is very important in relation to mental illness, raising awareness among organizations, government bodies, public and private sector. And this single message that suicide is preventable is very important to be disseminated to all sections of the society. Next. So it is our moral responsibility as healthcare providers to raise awareness, to reduce stigma about suicide, to well inform people regarding what action can be taken and how can we reduce instances of suicide around the world. So raising awareness is a very important component. How can we create hope through action is that this is a theme of Suicide Prevention Day from the year 21 to 23. And the theme is a reminder that an alternate to suicide is always there, at which aims to inspire confidence and light in all of us. So by creating hope through action, we can signal people who are experiencing suicidal thoughts that there is a hope, that we care, and we are there to support them. It is also a matter of our actions. No matter how big and small they are, they may provide a beacon of light to anybody who's struggling, to anybody, a pat on the back can be very therapeutic and remedial for people who are suffering in silence. Next. So creating hope through action is, it highlights on the importance of setting suicide prevention as a priority, and public health agenda by many countries, and particularly where there is access to mental health services and availability of evidence-based interventions, which are already low. So we can build our theme in this message, that we can spread this message over 3 years. A world can be emphasized where their suicides are not so preventable. Next. I would like to wrap up by saying that suicidal behavior with the consequent of fatal outcome is a public health problem, which is getting graver by the day. So it is our duty as healthcare providers to do something with our own personal capacity to be there for others, to listen to people in problem, to extend our hand of help to people around us, not only patients, to people in our neighborhood, to people we know, to children who are there, people you come in touch with, to contact with. We can see the red flags if a person is showing any kind of behavior you feel can cause self-harm. Be on the alert and try to do your best you can. Prevention and protective strategies for individuals, families, and communities will help to reduce the rate of suicide. So that is why we are engaging in activity like this for generation of awareness, to help people to reach out to others in need, what requires to be done. I'm sure all this deliberation of this webinar will be talking about that. So the people, and the most effective outcome of a webinar or an educational activity like this is that it should be related or translated into practice. That whatever you learn today here, try to imbibe it into your practice and try to make a difference in the lives of people around you. So how we can do this is by raising awareness, by reducing stigma around suicide, encourage well-informed key, which is a very important and a pivotal thing in suicide prevention. Next. I would like to wrap up by saying happiness can be found even in the darkest of times if one remembers to turn on the light. And always remember that there is always, whenever there's a breakthrough, it is always darkest before dawn. So we have to tell people that your struggles are real, but ending of life is not the answer. To be brave is to face the situation or problem head on, cope effectively, and come out of it as a victor. We have seen many, celebrities talking about depression. Recently, Deepika Padukone had come out talking about her depression and things, the darkness, demons she was facing. She was out in the public and she talked about it very freely. Many people have come out and, spoken about their mental health concerns or mental health issues very freely to the media. So we need some ambassadors like this, people who can share their, story of victory, that they faced problems, they had those, they were down in the dumps, but still they came out and they fought that and came out as a victor. So I'd like to thank the organizers for giving me this opportunity and for giving me this honor of being their chief guest. And I'm very sure that CNRS is doing a great job in, in disseminating knowledge like this, which is the need of the hour. Thank you so much.
Thank you, Deepika ma'am, for sharing your valuable information, knowledge, and in-depth experience related to suicide and suicidal thoughts. Madam, you have motivated all of us by being a living example of kindness and selfless services to our nations and our friends and people. You have given your best by sharing your expertise and knowledge in every way, possible way, to help a person suffering from suicidal thoughts. Thank you once again, madam.
Thank you.
Ma'am, there is one question. If Lata madam says, shall we take it now or do we attend it later?
I think better we can do it now, no?
I have answered that question in the chat box, but madam can give her expert.
Okay, ma'am. Okay, ma'am. Here is Mr. Ashish Kumar. Deepika, ma'am, he is asking that when we listen someone and give shoulder to cry who is in pain, but in that situation, the person is totally depending on us and influence our personal life also. So what a person should do in that kind of situation?
See, when I say shoulder to cry on, it does not mean that it ends there. At that point of time, if somebody is coming to you for help, you can listen to the person and then refer him to a expert, refer him to a psychiatrist. But at that point of time, when somebody is coming to you, you have to give them, your time of the day, listen to their problem. But sometimes we are not in a capacity to help the person. We don't have prescriptive powers. And you know that person requires psychiatric help and psychiatric intervention. So what I do is, even in my personal experience, there are times when students or people come to me. I give them the needful at that point of time, and then I later on refer them to psychiatry. Because that is the first point of contact. You give them a kind of psychological first aid, and then you refer them to the tertiary care or to the experts. And that is why we have to be professional. Whatever they are telling, you don't have to absorb it and try to see it in your own, in your own life. You have to be very professional in your attitude, deal with that problem there and now, and then refer the person to the experts.
Okay, thank you, ma'am. There are two more questions from Charlene and Lalita. They are asking that is there any awareness program or helpline number running in India for prevention and awareness regarding suicide? So I would like to say both of them that in the panel discussion, you are going to get answers of your questions. So please wait. Now moving ahead, we have one more expert to deliver talk on epidemiology of suicide. It's a great pleasure for me to introduce our speakers, Mrs. Veena Sharma ji, who is going to talk to us about present various statistics related to suicide. This is a subject in which we should all be deeply interested. Mrs. Veena Sharma is presently working as principal in Rufidia College of Nursing, Jamia Ahmedabad University, New Delhi. She has more than 30 years of teaching experience in education and nursing field. Madam has published more than 60 publications in various national peer-reviewed index journals. She has participated in faculty-student exchange program under Athena Higher Education Project at Sweden. She is member of Sigma Theta Tau International Honor Society of Nursing, Indian Society of Psychiatric Nurses. She has written and edited chapters in IGNU modules. She has been chief editor in Journal of Psychiatric Nursing and associate editor of International Journal of Nursing and Midwifery. She has having professional association with American Society of Higher Education, Academic of Hospital Administration, IGNU, Indraprasth University, and various other universities. I welcome Mrs. Veena Sharma Madam for sharing her thoughts related to epidemics of suicide and epidemiological data. Over to you, Madam.
A very warm good evening and greetings to Madam Shashi Bala, Dr. Lata Venkatesh, Dr. Deepika Khaka, who is the chief guest for the evening, and other executive members of CNRS. And I applaud the efforts of the executive members and office bearers of CNRS North Zone that they have organized this very apt webinar on suicide on World Suicide Prevention Day. So I am going to talk about epidemiology of suicide. The next slide, please. Now, suicide is a worldwide, national, local, and familial problem. And more than 7 lakh people die due to suicide every year, which means 1 in every 100 deaths. And 77% of global suicides occur in low and middle income countries. And India is one of the LAMI countries. And around the world, 20% of suicides occur due to pesticide poisoning in rural areas, especially in LAMI countries. And other common methods of dying by suicide are hanging and firearms. The next slide, please. And some of the startling facts about suicide are that every year more people die of suicide than HIV/AIDS, malaria, or breast cancer, or even war and homicide. And WHO has given a guidance that in order to, they have given a mandate that we have to reach the target of reducing suicide rate by 1/3 by 2030. And that is one of the sustainable development goals also. The next one, please. According to Director General of WHO, Dr. Tedros, I quote, "We cannot and must not ignore suicide. Our attention to suicide prevention is even more important now after many months living with COVID-19 pandemic, with many of the risk factors for suicide like job loss, financial stress, social isolation," unquote. Now, what is the nature of suicide? One of the common myths about suicide is that if we talk about suicide, then it makes the person suicidal. But then that is just a myth. Then most people who die by suicide have a history of suicidal attempt or self-harm, and that is considered to be one of the significant predictors of suicide. Then most people who are considering suicide are two-minded about suicide. That means they want to live life, but at the same time, they are so hopeless about life that they want to end it. Then many people who attempt or complete suicide give out warning signs. And it is for us, as Dr. Deepika Khaka also told, that it is for us to identify these warning signs in people around us and then reach out to them with help. And then suicide is not just a random act. Many people who die by suicide have a well thought out plan about it. The next one, please. Now, there are various philosophies or schools of thought floating around about suicide. One of the schools of thought about suicide is that suicide is a wrong thing to do. And there are many thoughts about it, that since God has given us life, it is only the God who can take life. And therefore, dying by suicide is a wrong act. Then Also, people believe that suicide is violence to the dignity of human life and also to the natural order of things. The next one. Other philosophies about suicide are that suicide is sometimes permissible. Like, for example, in case of euthanasia, where the person is terminally ill and he's in so much of pain that suicide or euthanasia or uh, dying is better than living a painful life. Another school of thought says that suicide has intrinsic positive value. That means sometimes people think that after they die, their life will be more meaningful, or maybe they can they can meet their long lost loved ones or their ancestors by uh, going to their world. The next one. The burden of now coming back to the epidemiology of suicide, the burden of deaths by suicide has increased in India by 7.2% from 2020, and that is also the time when the first wave of COVID-19 struck the entire world. Every year, more than 1 lakh people die by suicide in the country, and the National Crime Record Bureau report follows a 2021 Lancet study that noted that India reports the highest number of suicide deaths in the world. This diagram shows that that according to NCRB, accidental deaths and suicides in India report 2021, which has come out recently, I think 10 days ago, that Delhi tops the chart when it comes to the number of suicides, followed by Chennai, then Bangalore, and then Mumbai. So according to this NCRB report 2021, Maharashtra, out of all states in India, Maharashtra tops the chart as far as the number of suicides is concerned. This is followed by Tamil Nadu, then Madhya Pradesh, then West Bengal, and then Karnataka. And together, these 5 states account for 50% of all suicide deaths in the nation, as per the NCRB report. This diagram shows the same thing, and one can see the statewide distribution of death by suicide. And here again, one can see that Maharashtra leads the list, and the 5 states you can see here. The next one, please. According to, again, this NCRB report 2021, domestic issues and illnesses were the main contributors to suicide deaths in nation last year. And they represented domestic issues 33.2% and illnesses 18.6% of all suicide cases. So these are the 2 leading causes why people die by suicide. Another startling fact which NCRB report has given is that daily wage earners continue to account for the biggest proportion of suicide deaths in 2020, which is again the time of the first wave of COVID-19 pandemic. And if you may remember that that's the time when there was this mass migration of laborers and daily wage earners from cities to their respective villages and towns because of the total lockdown which happened that time, and they lost their jobs, and that was the time for a lot of despair and disappointment for them. The next one. Here we can see in this bar diagram that from 2014 to 2021, we can see that the number of suicides by daily wage earners has been steadily increasing. The next one, please. And as per this NCRB report, the farm laborers, they also were leading as far as dying by suicide is concerned. And in females, housewives made up almost 14.1% of all suicide victims and 51.5% of all female victims in 2021. The next one. This shows the top 5 states with highest student suicides in 2021. And again, here, in terms of the student suicides also, Maharashtra tops the chart, followed by Madhya Pradesh, Tamil Nadu, Karnataka, and then Odisha. Then why people die by suicide? So suicide occurs within a complex set of individual and social circumstances. And as healthcare providers, if we know about it, then we can use these theories to understand the complexity of suicide in society. So there are social theories related to why people die by suicide. There is lack of social support, people who experience sudden losses, stressors in their lives, and financial crunch or financial crisis. These are some of the factors, social factors, which lead people to suicide. As far as biologic theories are concerned, then people who have genetic predisposition towards chemical disturbances which lead to depression or psychotic disorders, they or also the people who take up this route of ending their woes, then low levels of serotonin in the brain, and then alteration in biochemicals because of the substance use disorders. That is some of the biological theories for causation of suicide. Then there are psychodynamic or interpersonal theories like loss of an important relationship, which causes so much psychological pain, overwhelming distress and despair that the only way out for solution is people think that it is suicide only. And as far as learning theories are concerned, that people who contemplate suicide, they think that the only way to deal with the life situations is by ending their lives. So they resort to one of the unhealthy ways of coping with their problems in life. Hopelessness about life in general, pessimism, hopelessness with oneself, with one's future, in interpersonal relationships. That is one of the reasons. Then any circumstance which generates hopelessness and despair and depression, that is also one reason why people are vulnerable to suicide. Then loss and abandonment are some other reasons why people die by suicide. The next one, please. As Dr. Deepika Khaka also said that social isolation is also one of the reasons for dying by suicide. As far as risk factors and warning signs of suicide are concerned, I came across this news clip, I think 3 or 4 years ago, in which I saw that this is one 16-year-old athlete in West Bengal who died by suicide. And one can see that she seems to be young and successful. And we think that what might have driven her to take this extreme step. So we have to look at, ponder over why she thought of or she contemplated suicide and executed her plans. So what made her at risk? The next one. This is another sensational Burari family mass suicide, which happened, I think, 2-3 years ago in Delhi. And in this, 11 members of a family, and their ages range from 15 to 77 years, they committed suicide. They all died by suicide overnight. And it was a mass suicide. And one wondered, there were theories floating around as to why 11 members of a family had to do this collective suicide thing. So people were making hunches whether this was a shared psychotic disorder, whether one member of the family had some delusions and hallucinations on which he acted, Were they following a cult, or were they attempting to attain salvation, or whether they were into some kind of mysticism? So these were some of the hunches which were going on. Homicide suicide is also very common. We have read in the newspapers that head of the family, because of some or the other reason, he killed his children, then he killed his wife and other members of the family, and then he killed himself. So homicide suicide is also very common, and the perpetrator is usually a male or the head of the family. And as far as the ways by which people attempted suicide or completed suicide, hanging was the most common of all. The next one. Now, if, as Dr. Deepika also told, that if we learn about risk factors and warning signs of suicide, then we can save lives, because then we can reach out to people and we can save precious lives. The next one. These are some of the risk factors. So in case of suicide, completed suicide, 25 to 33% of um, people who die by suicide, they have a history of previous suicide attempt. Then current depressive disorder is also one of the risk factors. Then 50% of people who die by suicide had family factors, such as lack of connection with parents, dysfunctional family, parents with SUD or psychopathology. And even in case of LGBTQ community, 42% of LGBTQ community people experience suicidal ideations. The next one. As far as psychiatric diagnosis is concerned, more than 90% of adults who take their own lives by suicide have an associated psychiatric illness. And mood disorder is seen in 15% of people, substance use disorder 20% to 50%, and schizophrenia 10 to 15%. And then there are the anxiety disorders and other disorders like eating disorders, body dysmorphic disorders, personality disorders, which are some of the predisposing risk factors for suicide.
Excuse me, ma'am.
Yeah.
Yeah, excuse me, we are having shortage of time, so ma'am, can you come? Can you little bit short your presentation, ma'am?
Okay.
Yeah,
Fine.
thank you, ma'am.
Yeah, sure. So in that case, yeah. So people in certain professions like police, armed forces, people who are unmarried, widows, unskilled or unemployed people, or poverty, people who are having disabling or terminal illness, they are also vulnerable people. The next one, please. What pushes young people to the edge? Next. So in young people, pressure to perform academics is one of the reasons. Kota in Rajasthan is the one place where there are a lot of commercial coaching centers, and the parents send their children here to prepare for entrance examination. And when they fail and they succumb to the pressure and end their lives by suicide. Next one. The people in the age group of 16 to 18 who are appearing in board exams, or who are appearing in these uh, entrance exams, they are also under a lot of pressure. Next one. Can we skip to the next one then? The next one then. So small, yeah, this is this in the pandemic year, we can see that the students were the highest as far as suicide rate is concerned, followed by professionals, daily wage earners, retired persons, and unemployed persons. Next one. Teenagers, few years ago, they were involved in blue whale suicide game, and we could see that they were dying by suicide because they were participating in this online game. The next one. Bullying is also one of the reasons. So 7% of adolescents were found to be bullied, either cyberbullying, body shaming, trolls, and then LGBTQ people are also 6 times more likely to commit suicide than the heterosexual youth. The next one. These are factors predisposing suicide in India. Family problems, illness 55%, drug abuse 3.3%, love affairs 3.2%, financial crunch 2%, failure in examination, poverty, and dowry disputes 1.6%. We have talked about these factors already. So next one. The next one, please. Can we skip to the, I'll move to the, then, this one, the farmer suicide in India. This is something very alarming because 60% of India's population lives in villages, and there was a time when the farmers were committing suicide almost every day in states like Maharashtra and Karnataka. And some of the reasons why they were committing suicide was, can we have the next slide, please? That either the crops failed or they were not getting irrigation water, pests attack, diseases, and farmers not getting their due, and agriculture as a loss-making profession. I'm just about to end. 1 minute, please. So that is my last slide. That I would just end by saying that as mental health care professionals, the plan of our care should be designed in such a way that the clients remain safe from self-harm and that they improve their problem-solving skills. Thank you.
Thank you so much, ma'am, Veena ma'am, for sharing your knowledge and sharing with us current statistical data, various factors behind suicide. And I hope audience learned a lot from your informative session. Really, your slides are very interesting, but because shortage of time, we need to cut it down. Now it's time for the panel discussions on various aspects of suicide prevention. For this, I proudly would like to invite my teacher, respected Mrs. Dr. Kamlesh Kumari Sharma Madam, along with our team. Dr. Kamlesh Kumari Sharma Madam presently working as Professor cum Principal in Institute of Nursing Education and Research, AIMS Batinda. She has 36 years of total teaching experience in nursing education, patient care, and administration. Madam has awarded the Amazonians of America Book Prize Award 2018 for Best Nursing Research Work, AIMS New Delhi. Madam has been member of various academic societies, including TNI, NRSI, NNF, IANN, SOCHNI, CNRS, etc. Madam has been Masters and National Trainer for CHO Induction Training, Neonatal Resuscitation Program, Infant and Young Child Feeding, IYCF, Essential Newborn Care, and Facility-Based Newborn Care, GFATM project, and Simulation-Based Learning. Madam has published more than 60 articles and papers at national and international levels and conferences. She has been editorial board member and reviewer in 8 journals. Madam is board member of various universities, AIMS, and institutions of national importance. She has contributed as a co-op member for Nursing Education Committee at Indian Nursing Council and Delhi Nursing Council. Now it's over to Dr. Kamlesh Kumari Sharma Madam for the panel discussion. Thank you, ma'am.
Thank you, Dr. Sushil Maheshwari, for your very kind words. Now,
ma'am, please unmute yourself.
Dr. Deepika Khaka, Chief Guest of the Day, Nursing Advisor, Government of India. Dr. Shashikala, President, CNRS. Dr. Lata Venkateshan, President, CNRS, North Zone, and the Principal College of Nursing, AIMS Delhi. All the eminent speakers and delegates, faculty, and other delegates, and panelists, sorry. So a very good evening to each one of you. At the outset, I would like to thank CNRS to have entrusted me with the task of Vice President CNRS, North Zone. I also thank the organizers to have me here as the moderator of the panel discussion. So dear all, I thank each one of you for investing your time with us on this Saturday evening. I know that everybody looks forward to this weekend break, and today we are engaging you here.
So today we have an amazing group of panelists who will talk about suicide prevention through evidence-based strategies. Our aim today is that irrespective of your position in the healthcare delivery system, all of you should carry home some idea, some new perspective that we can implement in the days to come in our working area or sphere. So first, we'll take a few moments to briefly introduce our eminent panelists before going into the discussion. And post discussion, we will open up the floor for the participants with their specific questions. Hope it sounds good to everyone. So let us get started with the panel introduction. May I request Dr. Sushil Maheshwari to help please with the slides. So first and foremost, we have Dr. Sunita Sharma. I think Madam requires no introduction. She is one of the stalwarts in the country as far as psychiatric nursing is concerned. Currently, Dr. Sharma is the Associate Professor, National Institute of Nursing Education, PGIMER, Chandigarh. She has over 32 years of rich experience, over 50 papers published in journals of national and international repute. She has presented several papers and delivered guest lectures in various conferences, seminars, workshops, and webinars, both national and international level, has chaired sessions in the various conferences and contributed chapters of mental health nursing. Madam has organized conferences and webinars and workshops. She has been the guide for PhD and MSc students for several years. She is the master trainer for GFATM and peer reviewer for journals and member of the editorial board. The list, I believe, is endless, but due to the paucity of time, we will not be able to complete that. Thank you for being with us, ma'am, and welcome to the panel. Next, we have with us, Sushil, can we have the next slide, please? Dr. Ratish.
Madam Pratigya, please show the next slide. Yeah.
Dr. Ratish Nair. So Dr. Ratish is currently Principal in Charge College of Nursing and CNO AIMS Patna. Formerly, he was working as the Secretary, Indian Nursing Council, New Delhi, member of Central Mental Health Authority, Government of India. He has delivered guest lectures and chaired sessions in various conferences and seminars and workshops and webinars at the national and international level. He has organized conferences, webinars, and workshops, and he has been the guide for PhD and MSc students. He is also the editorial board member and peer reviewer for several journals and members of the editorial board as well. Welcome to the panel, Dr. Ratish. Next, please. Can we have the slide for Dr. Muthu Venkatachalam, please?
Previous slide, yes.
Yeah. So, Dr. Muthu, it is really my proud privilege to introduce Dr. Muthu Venkatachalam. He is a former student, a former colleague, and a dear friend. Currently, he is working as the Assistant Professor, EBAS, Government of NCT of Delhi. He has written several books. I'm sure that Target High is something nobody will be able to forget. So everyone would be familiar with that. Recipient of the International Travel Grant from ICMR for International Conference on Workplace Violence in Florida. He also received sponsorship for 6th International Conference on Workplace Violence. And he's currently pursuing the prestigious FAMER Fellowship from Manipal University. He has organized several conferences, including ISPN National Conference, ICMR funded workshop, and NRSI conference, etc. He is the deputy editor of Indian Journal of Psychiatric Nursing. He is the reviewer in Journal of Psychiatric Nursing and member of Academic Council and Curriculum Committee, Swami Rama Himalayan University. Welcome to the panel, Dr. Muthu Srinivasan. Next, please. We are really glad to have Dr. Janarthanan with us. He is currently the faculty in College of Nursing, Jipmer, Puducherry. He has been conferred Seva Ratnan Dr. R.B. Gold Medal by the Tamil Nadu Dr. MGR Medical University, Chennai. He is the recipient of Vanavai Thiru Shanmuganar Gold Medal. Please pardon me if I'm pronouncing wrong. He is also having more than 47 publications to his credit, along with numerous other presentations. He is the member of the editorial board for various national and international journals. He is the examiner in RGUHS Tamil Nadu, Dr. MGR Medical University, Kerala University, and many more. He is also, he has been the resource person and speaker for several national and international workshops, conferences. Welcome to the panel, Dr. Janardhan. So it is good to have all of you for this panel discussion. Now, as we have just heard from the previous speakers, World Suicide Prevention Day is observed every year on 10th of September. And it has been over 2 decades that we have been, almost 2 decades that we have been observing this day. And the reason is very simple, because suicide is something that is emerging as one of the important public health problems. And whenever we are confronted with public health problems, the way we address it, we go by those various levels of prevention. We try to identify the risk factors, we try to identify the people at risk, and thereafter the next course of action, whether to refer somewhere, whether to manage at a certain facility. So those will be the subsequent steps. So in order to address, we need to identify who are the people at risk as far as the public health problems are concerned. So with this, I start this panel discussion, and my first question would go to Dr. Sunita Sharma. Do we have, madam?
Yes. Thank you, ma'am, for the introduction. And I think we will start with the panel. And at the onset, I would like to thank the organizers, CNRS, for giving me this opportunity. And I hope that we all give our inputs and we have a healthy discussion for that matter. Now, initially, before we talk about suicide prevention, let's see that what are the vulnerable groups. It is like you will see that the causes of suicide in vulnerable groups could be because of, if there is any previous history of suicide, that could be one of the reasons. Then if we have some substance abuser, or if there are some mental health issues which are diagnosed, or some major life transitions, if we talk about the job loss or divorce or whatever and all. And then multiple health comorbidities, some chronic illness, all these could be the reasons. Then history of any interpersonal conflict. So if we talk about the vulnerable groups for suicide, in youth, we will have the conflicts with the family, or some failure in romance could be one of the reasons, or expectations like career focused and not very successful in life could also lead to that. And then male adults could be like abusers, or job loss, or some marital discord could be one of the reasons. For females, they could be a victim of dowry, or domestic violence, or physical and mental abuse. So, and then for teenagers, of course, heartbreaks and mood swings and whatever and all. And then the suicide attempt survivors, they are also a vulnerable group, because it is not easy for them to survive like that, because people will have different notions for, okay, you try to take your life. You know, like it is not something, this is like a negative thing which people will portray. And then LGBT people could also be a vulnerable group for that matter. Then if we talk about people with physical problems, so they are also vulnerable kind of to commit suicide.
Thank you, ma'am. Very specifically, you have mentioned these various groups of people who could be at high risk, and particularly so the youth. Youth of today, we see that their numbers is on the rise, and those obvious reasons that you have stated right now. My next question is to my next panelist, Dr. Muthu Venkatechalam. Dr. Srinivasan, may I please ask you to highlight how big is the problem of suicide among the patients with the mental illnesses? It is not merely the normal individuals or others, but it seems that there is a problem with the people with the mental illnesses. As one of the speakers earlier said, a large majority of the patients, they are also dying because of the suicide. So how big is this problem in our country?
Thank you, madam. And I thank CNRS North Zone chapter for giving me this opportunity to be part of this panel discussion today. First of all, there is always an increased risk of suicide reported among psychiatric patients. And for example, mood disorders was identified in 25% of the people who died by suicide, and a more than 20-fold higher mortality ratio for suicide in unipolar depressed patient than in general population. That shows how significant and how the mentally ill people are vulnerable for suicide. And suicide accounts for approximately 15% of deaths in bipolar disorder. These are some of the data which suggests that patients with psychiatric disorders are at high risk for suicide. And some of the conditions which is have high prevalence are borderline personality disorders, unipolar and bipolar disorders, and depression, schizophrenia, even anorexia nervosa, which is common among adolescent girls now, and alcohol use disorder. Even in India, according to National Crime Records Bureau, 6% of the suicide in India is due to alcohol and substance uses. Of course, and if you compare the Western scenario, 90% of the suicide are due to mental illness. But where in developing countries like India, the scenario is not that, because even if you look at the NCRB data, 33%, that is 1 in 3 suicide is due to family problems, and another 18% is due to illnesses. That the psychiatric disorders also comes in that 18%. So roughly we can say 1 out of 6 suicide may be due to illnesses that includes psychiatric disorder. This is the.
So are you trying to say that the numbers are lesser in Indian population, Indian patients, as compared to the Western?
Not exactly, number is lesser, proportionally lesser, because other causes takes over in developing countries like India, where family values are more and relationship and family issues are taken over. So that's why that alone, one third of the suicide is due to family problems. That excludes divorce, marital issues, all those things. And individual factors also, there are many other financial crises, all those issues also come into the play. So mentally ill patients, that comes into the 1/6 of the total suicide. Of course, there is a very high prevalence and very high incidence of suicide among psychiatric patients, but those data we retrieve also from West, that is not reliable. We have to rely on NCRB data for Indian scenario. That's the most reliable data for suicide. So a nurse, since we are in close contact with the patient with psychiatric disorders, we have the prime responsibility, and most of these are preventable. So we have a lot of responsibility.
We will come to that. We will come to that in the subsequent this thing. But as you said, the numbers probably proportionately are less. Would there be a factor of underreporting as well?
Possible. Treatment seeking itself less, and people suffering from mental illness and reporting that, and again reporting the suicide also will be possibly less.
Is it possible to identify somehow these patients who might be at more risk of suicide?
Yeah, with the warning signs and risk factors, definitely it is, we can identify early. And also it is not just the patients, those who are seeking treatment and already diagnosed mental illness only commit suicide. Maybe the patient the victims who are committing suicide may have underlying mental health issues, which may not have been identified or diagnosed or treated.
So that is a very important point, that many times things are going underreported because of this factor, that yes, even the basic illness is not really that is not diagnosed.
There is another aspect, is that even the patient dies of financial crisis or family issues or marital issues, the person may be already predisposed to that. The patient may be under depression, not seeking treatment, not seeking any help, so he commits suicide. But as per the NCRB reports, it will be showed as a family problem, not depression.
Thank you, Dr. Srinivas. And next I come to Dr. Ratish. And Dr. Ratesh, what are the common suicide prevention strategies which are being adopted nowadays?
Ma'am, as per the evidence goes, like I could do a search, and we could find a systematic review which found some of the evidences of it's by Menon et al. In 2018. They identified some of the strategies which could be effective in prevention, and one is, I think we are all aware about the awareness part of it, because whenever we talk about suicide prevention, we talk about, I think, awareness for 90% of the time, and which shows how important it is even for the general public, and as well as for the health professionals, because health professionals, we have a habit of underplaying things, and many times underplaying things in the sense, even for if it happens to us also, many times we don't realize we are experiencing symptoms of depression, because many times we think we are immune to other diseases, because we are health professionals. It cannot happen to me, but that's not the case. It could happen to anyone. Anybody can experience depression or a self-harming thought. So other thing other than this awareness program, because one of the newest thing which introduced, even I think tried out also by NIMHANS, was is a gatekeeper program. A gatekeeper program which is being introduced, because as health professionals we cannot cover the entire public who are at risk, because a very minute percentage of the suicide happens inside the hospital. Very minute. It is negligible almost, and rest of the thing happens outside in the community. So having gatekeepers within the community itself is found to be a very effective strategy, because these gatekeepers as such are people who hold some kind of responsibility in the society.
So who are the gatekeepers?
The gatekeepers could be very well school teachers. The gatekeepers could be hostel wardens. The gatekeepers could be law enforcement officers like police, or it could be lay counselors who are available in hospitals, or maybe in general counseling centers, or even student counselors could be gatekeepers, because they will be most probably the first point of contact. Many times if a hostler is facing a problem, if the person is it is most probably the warden who notices first, this person is not moving out of the room much these days. As teachers, we are sitting in the college, we may not know. It's a warden. Unless if the warden is sensitized to such things and able to find out this person is experiencing some trouble and identify that person as a gatekeeper, we'll be able to save lives. And that is one kind of an evidence which I found, that having gatekeepers within the population or the community itself, because I consider hostel also as a community where I think it is a better community than many other communities, since we have all been in hostel life. So these are 2 points. And finally, the other point which has come up is having a responsible media. Mass media or a news media who is these days, I have stopped watching news channels because of the fact that it is more of sensationalism than news, because everything is a sensation and everything is breaking, and there is no responsible reporting of cases. I think we have seen in the very recent past of celebrity suicides. And I think one of the suicide which was blown out of proportion was Sushant Singh Rajput case, which is still in our memories, and how it was blown out of proportion, and the minute details of the case which is being described in the media, what exclusively, and the length of the rope which was used, how it was tied, how a notice to be made, and these kind of sensational reporting. See, that is not required for a public to know how a note is made for a suicidal note was tied. That is for the investigative officers to know. And but it is described with, and media houses with their news anchors report in such a way that it is creating some sort of a fascination for people. And we are talking about 14, 15, 16, 17-year-olds who watch these programs. And these are celebrities who are their heroes or heroines. And they watch these kind of programs, and they get very fascinated about something which is very new, because nobody talks about suicide at home. And you get to watch that kind of program once in a while, and people find it very fascinating. And that kind of mind, young mind, immature mind, takes it to their head. And the next time they think it is something fashionable to do, because it is a celebrity who has done it, and he was all over the news. Maybe this is their last chance to fame. And that kind of, because an immature mind, we don't know what goes in their head. So
in your expert opinion, what needs to be done to prevent such a glorification of the media by the media?
While we are talking about sensitization or creating awareness in the general public, I really feel the news media houses should be sensitized. They should be part of this while preventing the suicide prevention or anything, which the message should go to the media that while reporting is their job, they have to do it responsibly. And there is a limit for to the extent which they should go about divulging in the details of suicides, because they are giving unnecessary ideas to people, or maybe people who are in trouble, who are just waiting. It is just like people who are just waiting for a trigger, and the media is giving that trigger. So
what I'm hearing, what I'm hearing is that the media should also be sensitized about what to do about those do's and don'ts.
Of course, the media is as good as or as bad as a general public about a suicide. They may not know what they are doing. If they are they know or they realize that they are doing such harm to a group of population who is vulnerable, many times I don't think they will do it if they know really they are doing something which is very bad. So that message need to go to the media houses, so that people are sensitized towards responsible reporting of suicide cases.
Very right. Thank you so much for that response. Now, my next question would be for Dr. Janardhanan. Dr. Janardhanan, has the government of India taken any initiatives in this direction to reduce the harm because of suicides, or to prevent the suicides?
Yeah, thank you, madam. Am I audible?
Yes, yes, you are.
Yeah, good evening. Before beginning with my deliberation, I just wanted to thank the organizers, especially the executive committee members of CNRS North Zone, for having given me this opportunity to be a part of this panel discussion. Yeah, coming to your point, madam, like you've asked me about the Government of India initiatives to help prevent suicides. So before moving on to the Government of India initiatives, I just wanted to reiterate the fact that prevention of suicide could be made possible only if it is involving a kind of multi-sectorial and multi-dimensional coordination. When we speak about multi-sectorial coordination, I think government, both central and state government, plays a very pivotal role, and their contribution in terms of making policies, protocols are inevitable. So in that way, if you speak, we have to accept the fact that this suicides are becoming a serious public health issue. And as the previous speaker also said, that it is one of the United Nations Sustainable Development Goals, and they have actually aimed to reduce the suicidal rates by 1/3 of 2030. Coming to the Government of India initiative in specific to this particular topic concerned, I would like to just talk a little bit about the Mental Health Care Act of Government of India, which was implemented in the year 2017, and they had very specifically done one remarkable milestone in actually connecting the policy making. What they have done is, like, they have done something called as decriminalization of suicide, which means that they have actually nullified the laws of Section 109 of Indian Penal Code, and that attempting suicide is not actually a crime. So this is one of the major moves which Government of India has taken. Ask me a question like how this is going to be preventing suicide. Actually, this is going to be a very important initiative to reduce the stigma associated with suicide. Because when you get someone who has attempted suicide and who's undergoing hospitalization or getting recovered and sent back to the community, I think the stigma is something which is making them even more downtrodden, and even sometimes it makes them to commit suicide once again. I think in that way, if you think this decriminalization of suicide by government of India is one important thing which I want to mention here. And apart from that, they have also clearly stated that these people who have attempted suicide and got hospitalized are also eligible to get access to free treatment and rehabilitation services in the government hospitals or in private hospitals according to the need. And moreover, when we talk about the government of India initiatives, I would also like to add upon the national mental health outreach component, which is very clearly indicated in district mental health program, states and emphasizes about this suicide prevention services. So these are some important things which we have to keep in mind. And most importantly, what we could understand from all these initiatives by the government of India is that, like, they have clearly stated that reducing stigma, increasing awareness among the general public, and commitment to suicide prevention and location of resources. These are the 4 things which they have very clearly brought out in order to prevent the occurrence of suicide actually. And one more important point which I would like to tell here is about the non-government initiatives, because non-government initiatives as such, though not purely government, but still non-government initiatives have got things to do in association with the government in such a way. If you really look into the non-government initiatives, I would like to talk a little bit about the organizations such as Sangat, Hanknan Institute, and Astra foundations, who are actually trying to deal with suicide rates among youth and crisis management for employees, and to focus on the target groups of student community. And apart from that, they have also initiated a project called a Siren, in which they have created a policy in consultation with the government, which is called a
Okay, I think
they have actually evaluated. Am I clear now?
Yes, please go ahead. Yes, please.
Yeah. I was on this silent project in which they have laid down a policy called as Center for Mental Health Law and Policy, connected with what a little before, where they actually evaluate the extent to which the Indian newspapers follow the WHO guidelines in reporting the incidence of suicides. Actually, they have given 2 important strategies here. One is called as Werther effect. Another one is called as Papageno effect. This Werther effect is what we call as this contagion effect of reporting suicide, which is not really acceptable. And they have actually told or initiated the process of emphasizing these medias to go ahead with this Papageno effect, which is also called as responsible reporting of the suicides. And apart from that, there is another project which is called as Spirit, which is called as Suicide Prevention and Implementation Research Initiative. And this is mainly focusing on creation of awareness among people who are living in the rural area. Apart from that, there is a very important thing which is called as Gatekeeper Training Program. I think this is also spoken by Dr. Ratesh Nair, and this is actually initiated by the Suicide Prevention India Foundation, which is SPI, a very famous organization trying to reduce rates of suicide in India by initiating this Gatekeeper Training Program. Apart from that, there is another strategy or program called as National Alliance for Suicide Prevention. And here what they have done is they have started an initiative called as Mariwala Health Initiative, in which they have started a national alliance to bring together individuals from multiple sectors, and that's where the multi-sectorial approach comes in, where they have actually published an article named Suicide Prevention, Changing the Narrative, so which is mainly focusing on the real or actual narrative of how suicide takes place in India. So that is something which is very important and noteworthy to mention about. Apart from that, I would also like to mention,
if I might interrupt, we see that in rural India also a lot of suicides take place, and for that many times people are using pesticides. So for that I believe something, and there is some action by the government of India.
Yes, madam.
I'm going to.
Yeah, yeah.
That's so?
Like to be very directly mentioning about, since you've already pointed out that it is called a centralized pesticide storage facility, which is almost like this locker which we usually do the jewels in the bank. Like this is initiated by Government of India along with the Sneha Suicide Prevention Center and the World Health Organization collaboration. And this project has actually started with 2 centralized storage facilities, especially in Tamil Nadu. 2 villages are being chosen, and they have initiated this one where the farmers can just store their pesticides in the locker, which are provided to them, and they can just go to the home without carrying it in hand, and they can just come in the morning and take the pesticides whichever they wanted to use in the farms. And this has proven and showed a very distinct reduction in the rates of suicide, especially among the farmers using the fertilizers and pesticides in villages.
So my question over here is it only a pilot project, or is it something that is rolled out in other states, districts?
Actually, as of now, it is in the state of piloting, and in the future, it is going to get, seen all over India, because there are 2-3 research projects that are also undergoing concerning to this project, and they have proved, or they have actually stated that this is found to be very effective in reducing the suicide rates in rural areas, especially because of fertilizers and pesticides.
Thank you. Thank you so much for elaborating so well about this problem, about the government initiatives. Now, my next question will again go to Dr. Sunita Sharma. Ma'am, we see that help-seeking behavior in Indian population that is gradually taking up in regarding the various health conditions. But when it comes to the mental health conditions, and particularly with regard to suicides, I think that is dismally low. Anybody who is having any suicidal ideations, most literate people also, they would not like to seek health care. So what is it that is preventing them? What are the barriers and challenges?
Actually, I think if we talk about it initially, the assessment is not there. We don't know which people are vulnerable for that. And as long as we identify the problem, we will be able to rectify. And for that, we need to sensitize the teachers, the parents, and the society at large. Because if we identify, say if someone is even giving the pointers like, I don't want to live anymore, or I am not very happy with how life is moving with me, or always preoccupied with it, maybe we will just not bother much. Considering that this person has some attention-seeking behavior, or he or she is not able to cope up with the stress and all, so they are putting up an act. So taking this matter seriously is something which I think we all should be considering that. And for that, if somebody is saying goodbye or trying to wind up things and not socializing much, so these are the warning signs. And if we talk about suicide, this is an impulse. Once this impulse is over, maybe we can save the person, isn't it? Because it is not a thought of process and not planned. Usually the ones who are planning will only attempt to suicide. But the ones who commit suicide, it is an impulsive act. So I think if we can reduce that impulse by just knowing, and for that we need to tell everybody to kind of identify the people who are vulnerable and the ones who are like not. See, now the support system is dying. If we talk about our family support system, it is not there anymore. These days we have nuclear families and both the parents are working. And if we talk about the corporate world, if the father is working in the morning shift, the mother is working in the night shift, whatever and all. So when do they see the children? So it is all like you compensate the other way around. Spending time, knowing the person, and then just taking sort of, I will say, personal interest in what is happening to somebody. If somebody is upset or not, we are so much absorbed and involved in our work that we will hardly have time to ask, how are you? That also we do it through WhatsApp and sending emojis. Okay, you will feel better. It is all right. You'll be fine. Don't worry. It happens with everybody. We cannot take that casually.
So what you are saying is,
yes.
What you are saying is the parenting style also needs to be changed.
Yes. parenting style is very, very important, that how close you are to the child. I think in the morning webinar, we did discuss this, that how do you parent your child is extremely important. And plus identifying the problems, what he or she is going through. Even if we talk about the peer group, our colleagues, if somebody is like sad or upset, let's have the courage to ask what's wrong, what's happening in your life, right? And if you offer your services, and if you are kind of offer that he or she can definitely confide in me and maybe can discuss the matter, what he or she is going through, maybe something worse is happening in their family life, and on the job they're not able to give their best, and we will say, oh, he's very lazy, or he's not doing, he's just taking leave and all. We don't know what he or she is going through. And one fine day, we might get a news that he or she is no more, because there was no support system from all of us. And I think we all are responsible for each other's mental health too. That is why it is important to socialize, to allow somebody to ventilate whatever they are going through. And please, I think this is a request for everybody to find time for others. We are so self-absorbed and so much within ourselves that we will not find for others what they are going through. And maybe if all of us can save one life each, I think we have achieved what we need.
That is a very important message. That is a very important, critical message, to find time for the others. With this, I move on to Dr. Muthu Srinivasan. Sir, may I ask, in case there is a patient who you suspect might be thinking of committing suicide, so what is it that the nursing responsibility involves?
Please unmute yourself. Please unmute.
Sorry for that. Prevention of suicide among psychiatric patients actually starts from risk assessment. That is the first point. Whenever the patient come into contact with the healthcare professional as a nurse, it is our responsibility to assess for suicidal risk. And unlike the popular belief, you straight away ask the patient whether do you have suicide thoughts. If the patient says yes, explore the plans, whether the patient have any certain plans, any time, point, all those things. So that shows whether the patient is at risk for suicide or no risk, at risk or no risk. If it at risk, then it is mild, moderate, or severe. Depends on that. The nurse has to plan for prevention of suicide. It starts from in institutionalized setup in hospital. Preventing shops and avoid any opportunity given to the patient to commit any suicide, including no suicidal contracts, and counseling the patients, mobilizing the social support system and family support system, educating the family. All those things are very, very important. And treatment, of course prescribed by the doctor, but the treatment also very important factor to control the psychotic features. So because the severe psychosis is one of the major risk factor for committing suicide. And another important thing here is the first few days of admission and few weeks after the discharge is the most risky period for committing the suicide. First few days and the few weeks after the discharge, especially in depressed patients, when they recover from the condition, the most of the suicide happens. So this during this risk period and after even discharge, that I mean after discharge, when the patient recover, then most of the suicide happens. So the patient family members has to be educated. The warning signs, all the patient family members should be educated to observe for warning signs, so that they can seek help or counsel the patient and mobilize the support things. These are some important things a nurse can intervene to reduce the risk of suicide among mentally.
So there has to be ongoing monitoring of these patients
Yes.
who are discharged.
Yes. Of course, drugs help, but apart from that, other psychosocial measures like cognitive behavioral therapy, dialectical behavior, where the patient is taught to manage painful emotions. Because often this is also one of the common reasons when particularly in depressed patients, when they have painful emotions, they develop fearlessness towards committing suicide. Because the painful emotions, even if you go search the Google, the most common search regarding suicide is that how to commit suicide without pain. So even the people who develop suicidal thoughts have fear of committing suicide because of the pain. So when the painful emotions in psychiatric patients, physical pain in chronically ill patients, in both cases, they think that committing suicide is not an issue. I have no fear about committing suicide because the pain which I'm undergoing is more painful than committing suicide. That develops a fearlessness towards them that need to be taken care.
Thank you. Next, one more question I will ask Dr. Rati. Somebody mentioned about the first aid in mental health in these suicidal cases. So what does it mean? What does it involve? First aid, first of all. And secondly, who are the people who are capable of providing this first aid?
Ma'am, as first aid, while we are talking about suicide prevention, the first aid is, it could be given by anyone who has an orientation or at least a patience to listen to the person, what the person has to say. So the gatekeeper is mainly made on that concept only, where the person is, if you are a good listener, if I know we work with many hundreds of people, and when we have a problem, we choose a particular person to talk, because that you decide that at least this person will have time 2 minutes for me. Or if I decide to call somebody, if I am deciding to call Dr. Muthu and talk to him, it means I have that trust that he will spare 2 minutes for me to at least listen to me. So that kind of an opportunity, many times we should not miss. So in case of psychological first aid or the first point of contact, that is the turning point in any suicide prevention strategy, where a person who has self-harm ideas or suicidal ideations, if a person, many times the person needs a trigger to start talking. So as like Dr. Muthu said before me, when in the hospital, many times it is, we as health professionals also think all those who commit suicide are psychiatric patients. That is not the case. We have seen during even the pandemic, the first wave of the pandemic, many suicides, many preventable deaths we have seen of people who are educated, people who are well aware of things, and it is because of I saw that all over coming again, the HIV/AIDS time of 1990s, when people committed suicide, the kind of stigma which was associated with the COVID in its first wave. So and suicide also has its own stigma. And one other thing is, many times suicide, I prevented once a person committing suicide or seeking help, it doesn't mean that person will not attempt again. Once I was successful in getting the person help, but that doesn't mean the person has already become vaccinated for not committing it again. It is not. And that person, once the person was lucky, next time that person may not be lucky. So many times a person who has had history of and self-harming behavior or suicidal ideations need to be given preference or need to be assessed properly, and that person need to have been in contact. Or the main thing, ma'am, these days, I think, as like Madam Sunita Sharma said, these days people don't have time for anyone. People don't have even time for themselves. And because if you look at people, there may be even people who are not even taking bath daily because they don't have time, because they don't have time for themselves. So we are talking about giving time for others. So having one person to talk, this is, we should encourage about everyone. Everybody should have a support system. It essentially need not be your spouse, it need not be your sibling, it need not be your parent, it need not be your classmate, it need not be your colleague, it could be anybody whom you trust. At least one person to talk to in case if you want to talk to. That is something which we should encourage everyone, including ourselves, because we are not immune to anything. We are not vaccinated for anything. We all will go through ups and downs in life, and life is not fair to everyone at every time. So we all should encourage that one. And this is one point I just wanted to make. And before, I think we are running out of time and we'll finish it off, I would like to thank the organizers for giving me
You
this
will be
opportunity.
given the time. For
Okay.
thanking, you will be given the time.
Thank you. Thank you.
Just one last question to Dr. Janardhanan, please. Very often it
Yes,
is
ma'am.
seen that people do not want to, even if they are having the suicidal ideations and they truly want to approach somebody, but they are fearful because of the stigma. Even their family members, they don't want to talk to them. So what is the way out?
Thank you, madam. And I think that's where the role of helpline numbers comes in. So like, I just wanted to tell that this helpline numbers are actually initiated by the government of India, and there are a lot of non-governmental organizations which are also very actively involved in helping people by establishing these helpline numbers. Actually, there is something called as Kiran. Actually, this was launched in the year 2020, and this is the first ever mental health toll-free number given by the government of India, especially the Ministry of Social Justice and Empowerment. And they have actually developed this in order to provide psychological support in the wake of psychological issues associated during this COVID-19 pandemic. And that's where this was actually initiated. And this went on to really play a major role in helping people who are actually having the suicidal thoughts in general as well, not just confined to only COVID-19 pandemic, but it is also helping people who are having who are actually in need of help during their crisis in general as well. This particular service, Kiran, actually provides multifaceted services, which includes screening. Screening is being done through online. Mental health first aid is being given, and they also do crisis management and referral to tertiary care hospital, where professionals would be giving them help, support, and all that. Actually, this particular helpline service is actually having 600 clinical psychologists and many psychiatrists in their team, and they're actually undergoing training from time to time in addressing the issues and needs of people who are in need of help. And they also offer the services in various languages. I think it is around 13 to 14 languages they're giving these services as well. Apart from that, I think anybody can just search in Google and they can find out the suicide crisis lines which are available in India. In India, we have a common national emergency number, which is 112. This is a common national emergency number, which
I think
can
everybody
still
should
be
note it down
used
today.
Yeah. I
Please
request
carry
all the
on.
participants to just have a note on this. And this is actually very much available in internet as well. This is 112, which is a national emergency number in India, which is also useful for people who are actually in need of help when they are in despair or psychological distress. Apart from that, there are many non-governmental organizations who have initiated services to help people who are actually in need of need during their crisis time. And these toll-free numbers, we have actually two categories. One operates 24/7. They operate throughout the day, throughout the week, throughout the month, and throughout the year. And there are certain organizations where they have services only during a specified period in a week. It could be from Monday to Saturday, and they operate from specific time to specific time, like that. So depending on the need, necessity, I think we have to avail the services. And what we have to really teach people is that, like, what kind of services are available when. Services which are available 24/7 and services which are available during specific time in a week. If you look into the services which are given 24/7, I think Kiran is one of the most important things the government of India initiative. And apart from that, we have something called as Vandravella Foundation. We have Astra, which works 7 days in a week. And apart from that, we have the Sneha India Foundation. And we also have something called as Child Line, which is exclusively meant for children who are in a state of despair, and if they really need some help, that could be given for them. And as far as yeah, madam, would you like to intervene?
Yeah, please carry on. Because quickly now we need to wind up. I can see Sushil is getting a little restless over there.
Yeah, I'll just quickly wind up by telling a little bit about the apps which are available. Actually, suicide prevention apps are also available now. As you all know that everybody is having an accessibility to an Android mobile phone. And if it is really necessary, probably with the guidance and support of the professionals, they can even download this app in their mobiles, and they can even get services through that. Few examples of those apps which are available in India as of now is called as Not Okay. This is an actual this is an app which helps individual who can just download this in a mobile phone and access the services. Apart from that, we have something called as Better Help, Samasa Suicide Safe app. Like that, there are many apps available which also could be placed on record during this panel discussion, and I think we can even take this to the people who are actually in need of that.
Thank you, Dr. Janardhanan, for informing about these various resources. So there is tremendous resource that is available.
Yeah.
Now with this, I will open the floor for discussion and quick questions from the audience, please.
Yeah, thank you, ma'am. It was wonderful panel discussions on various aspects of suicide. And we all are attentively listening the opinions and the information shared by the various speakers.
Are there any questions, Dr. Sushi?
Yes, ma'am, there are a few questions. So if you allow, I may read from the question and answer box.
Please do.
Yeah, okay, thank you, ma'am. There is one question: is overthinking or extra emotional nature is also a reason of suicide or suicidal ideas?
May we take this question to Dr. Sunita, ma'am?
Overthink, that is like you are little sensitive about the whole issue, and it is like you need to work on your I will say improving your personality and having a strong control over your emotions. And because you overthink, you land up nowhere, isn't it? It is not going to solve problem. So the best thing is that you carry on doing something, whatever you are pursuing. And if you overthink, you will not end up anywhere. You might not be able to give your output as much it is required, because you will be preoccupied, and then you'll be disappointed with what is happening, because you keep on overthinking and you anticipate before it is happening. Right? So do not make that as part of your personality. And thinking is all right, but overthinking, excess of everything is bad. So the same thing goes with overthinking too.
So overthinking itself, that could warrant some counseling.
Yes.
Madam, I would like to add on to Dr. Sunita here. I think life skills training program is also very essential. I feel. I think in order to get all these things corrected, I think training in problem solving, decision making abilities, all these things are also very essential, which helps individuals a lot to really frame their thought process.
And plus, how to use your coping skills effectively, and how do you bounce back? Resilience.
That's a dialectical behavior therapy, to be frank. That's a type of cognitive behavior therapy. Dialectical
really help,
where we bring about teaching skills to handle those emotions and thought process.
So I believe this question is well answered. Now, any other question, Dr. Sushi?
Yeah, ma'am. One more questions we would like to take. That is from Mr. Pradeep Ahi, lecturer from Maharashtra, Sangli. The question is that, are we planning any mass media or student awareness program regarding suicide prevention? Because many of the questions they are asking related to suicide amongst students, suicide at the time of their disclosure of results. So like how to deal that situation, that particular time when the results is declared, suppose NEET results or GMAN advanced results or any other results which might be important for their life. So in that situation, the number of suicide cases arise. So how to deal with that situations, and is there any plan for mass media or student awareness program? I think it is a little bit administrative question, but still, ma'am, you may assign to any of the speaker.
Yeah, Dr. Muthu, can you please take on this?
Yeah, there will be usually a mass effect whenever this kind of happens. The people who are connected with the common reasons. For example, a couple of days before there was a NEET result, one person commits suicide due to failure, and that is portrayed in media, and that has a bandwagon effect. Like what do you call that? Bandwagon effect. They get influenced by others.
It's like communicable disease.
Yeah, right.
Contagious.
It happens at a point in a defined geographical area sometimes, and sometimes it happens at a mass level across the boundaries due to, there is some common thing, some celebrities committing suicide, or there is some common point which connects all these people.
That is a picked up behavior.
Yes.
Yeah, I think I just want to put a point here in addition to what Dr. Muthu and Madam Sunita Sharma said. For the suicides which are accompanied because of failures in case of examinations in like NEET, the candidates who are appearing in NEET examinations or competitive examination, of course, needs support. At the same time, I think it is the parents who needs the counseling, because you burden a child beyond their capacity, because every human being is not expected to clear NEET. If everybody is going to clear NEET and becoming becoming a doctor, who will do rest of other jobs?
Yeah.
So the world has to exist, and I think we need to have a helpline even for sensitive sensitization program for the parents as well, because that is the basic reason where it stands and why that child goes, because the child gets into a feeling that they have failed the parents, because they think that they have failed them, they have let them down. That is why they are going to the extreme end. So I think both the groups have to be sensitized together. So that is what I just
very rightly said by Dr. Ritesh, because higher expectations of parents is something which they are worried about, and they are not able to match up to the expectations of their parents. It is not their performance which is kind of hindering or making them feel like that, but what parents will say, what will be their response. That is why they have the fear of, some of them will not go back home, and then they will commit suicide because they cannot face their parents, because they said very casually, they will say, if you don't get 98% mark, do not come home. That's a very casual kind of statement, but they take it seriously.
Yeah.
So it is the parents' expectation which is creating problem.
This is known as community cluster, suicide cluster. One is mass cluster, the other one is point cluster. Mass cluster happens across the boundary, and point cluster happens in a defined geographic
because
area.
They consider it as their social status.
Yes.
And especially when you compare that my colleague's daughter or son got that much marks and see how much you got. I can't even face them now. That was my junior whose daughter got 98% and you got only 70%. So I think it is the comparison, and parents really need to be sensitized for that. Do not compare your child. Every individual is different, and they all have individual capacities and intellectual capacity for that matter, and we should not be expecting wonders from our children.
So we should understand holders, be that child, be that the teacher, be that the parents. Everybody has to be sensitized. Dr. Sushil,
no, ma'am, no more questions. Any concluding remarks from moderator side?
Yes, please. So we have heard the bad and good about suicides. We have heard the bad news that it is something that is rising in the society, particularly in our Indian society, and it is increasing in the younger lot, in the youth. So that is not something that is heartening. But the good news is that it is something that is preventable. Good news is that with the appropriate resources and methods, it can be handled, it can be prevented. Can we eradicate this like smallpox? Maybe not. But we will be definitely able to mitigate the effects. We will be able to reduce the incidence and the prevalence with the effort of all the stakeholders of the various levels of the society, within the society. So we all can support and create the hope through action and be the light, as has been mentioned earlier. The bottom line is increase the awareness regarding suicides and its prevention. At the same time, also invest in the capacity building, because without that, appropriate management will not take place. So World Health Suicide Prevention Day, now on this occasion, it is time to reflect on the value of life, and no matter how bad the things are, there is always hope. So believing with that, we wind up here. Thank you, everybody. I thank you all the panelists for these wonderful deliberations and their inputs. and thank the organizers. Thank you.
Thank you. Thank you.
Thank
Thank
you,
you.
CNRS and the organizing team. Thank you.
Thank you, Madam Kamlesh Kumari Sharma ji from Principal College of Institute of Nursing Education and Research, AIMS Patinda. And all the panelists, Dr. Ratish Nair, Dr. Muthu Venkatachalam, Dr. Sunita Sharma Madam, and Dr. Janardhan, my friend. So thank you so much. It was really a wonderful and interactive panel discussions. And still you have a lot of information with you, which you want to share right now. But because of shortage of time, we have to now move ahead. So at the end, I would like to ask few of the participants if they want to share anything from their side, if they want to say or give feedback for the program or this webinar, they can raise their hands. It's now participants or delegates time. Only we would like to take two of the participants. I can see Mr. Ghanshyam Jangid is there. Mr. Ghanshyam, you can speak now. You can unmute yourself.
Yeah. Am I audible, sir?
Yeah, you can go ahead.
Okay. Thank you, Dr. Maheshwari, to permit or giving me opportunity to be part of this wonderful webinar on Suicide Prevention Day. And it is also immense pleasure that today is also that North Zone CNRS chapter is also had been established here. Actually, we have learned so much through this webinar, as Dr. Khaka Madam has enlightened how to prevent suicide and what are the role of public and personals in this particular problem. Dr. Veena has elaborated on epidemiology of suicide and nature of the suicide. And we have learned so much from the panelists, Dr. Sunita Sharma, Dr. Ratish Nair, Dr. Muthu Venkatasan, and Dr. Janardhan. They have enlightened on vulnerable group, suicide prevention, and the gatekeepers in this particular problem. And government initiative has been taken from the regarding this suicide. So I think all of the audience of this webinar has learned so much, and I am so thankful to be part of this particular program. And thank you so much, sir.
Okay, Ghanshyamji, thank you so much for sharing your experience with this webinar. One last, I think here is Ishita Randhawa. What you would like to share with us, Ishita?
Yes, sir. Good evening to one and all. And this session is very good, and I would like to a special thanks to Dr. Latha Venkatesan, ma'am. Thank you, ma'am, for inspiring and encouraging us with your words on this special day. And I would also like to thanks all the speaker for giving us such a great knowledge. And I also thanks to Dr. S.K. Maheshwari, sir, for organizing such a beautiful webinars, and organizing team, and for organizing a hard for the past few days to make this webinar successful. I really appreciate the opportunity. Thank you. Thanks to all, sir.
Thank you, Ishita. Now it's time for vote of thanks. I would like to call Dr. Lekha Vishwanath, Chairperson Bylaws Committee of North Zone CNRS, and Principal and Deputy Director Nursing, Amrita Hospital, Faridabad. Over to Dr. Lekha Vishwanath.
Thank you, Dr. Maheshwari. I'm extremely delighted to grab the opportunity of extending vote of thanks in the launching event of Clinical Nursing Research Society of India North Zone. First of all, let me thank Dr. Deepika Kaka, Nursing Advisor to Government of India, for her present and an excellent keynote address. I also would like to thank Madam Veena Sharma for her expert talk on epidemiology of suicide. And really, the panel discussion was really an eye-opening discussion, going into the root cause and exploring the practical measures we should focus on. It was, I would like to thank our moderator, Dr. Kamlesh Kumari Sharma, the panelists, Dr. Sunita Sharma, Dr. Muthu Vengachalam, Dr. Ratish, and Dr. Janardhan for making it interesting as well as informative. Now I take the opportunity of thanking our NoteZone team for coordinating the event effectively, especially our president, Dr. Lada Venkateshan, and Dr. Maheshwari, and all the team of CNRA NoteZone and also CNRA national level for all the support for organizing the program. And I also thank CBS Publishers for facilitating the event. Finally, I appreciate the responsible participants for sparing the weekend for learning and their contribution for the prevention of suicide in the country. Once again, thanking you all. Thank you so much.
Thank you so much, Dr. Lekha Vishwanathan, for giving vote of thanks. Now we are at the end. I would like to again thank all of the delegates, chief guest of the day, President CNRS headquarters, President North Zone CNRS, Vice President Madam Kamlesh Kumari Sharma ji, all the other EC members, delegates, participants. Thank you so much for joining this webinar. It was just a first effort from our side, and I am sure that North Zone will come up with more and more interactive sessions for you in the near future. A special thanks to Dr. Muthu Venkatachalam for helping me whenever I need from any purpose. Thank you so much all. Thank you so much. Have a good night.